Namaste and welcome to our Facebook Live session. Today, we are going to be discussing a very important yet often overlooked topic, stroke amongst the youth. And we're very honored to have with us Dr. Sathish, Senior Consultant Neurologist and Stroke Specialist at Apollo Speciality Hospitals, OMR, here with us, who will be sharing his wealth of knowledge and expertise. Dr. Sathish will be answering all your doubts and queries, providing utmost clarity. A very warm welcome, Doctor.
Warm. Namaste.
What exactly is stroke and how does it differ in young adults compared to older adults, Doctor?
Yeah. So stroke, it's a medical emergency. So stroke means there are two types, ischemic and hemorrhagic. This is either due to a blockage of blood vessels, disrupting the blood flow and oxygen, or the rupture of blood vessels. So even in older age groups, it's very second leading cause of death. So in younger age groups, it's alarming because there are more increasing younger age group strokes nowadays, and specifically after the post-COVID era. And having said that, it divides from starting from the neonate, it can happen to anybody at any age. So we are more focusing about stroke less than 55 years. So less than 30 years, the incidents are 10% higher than the general average population. Between 35 to 45 is the higher risk, where there is almost 30% more chance of strokes in nowadays because of so many other factors. So it's completely different from stroke in elderly in every angle, the risk factors, the clinical symptoms, the way they come to the emergency, and how we handle those cases.
You mentioned about various factors that affect the youth today with respect to stroke. What are the primary causes of stroke in younger adults and how common are they today?
So strokes in younger adults are almost, the types of strokes are as equivalent to the elderly also. So we have ischemic strokes, we have hemorrhagic strokes. Among the hemorrhagic strokes, we have also trauma or infection related subarachnoid hemorrhages. So coming to the causes, as the conventional traditional risk factors like hypertension, diabetes, obesity, atherosclerosis. So the younger strokes have more often hidden, difficult to understand the causes, which are like, sometimes in females we have migraine, headaches. We have pregnancy per se can have more chances of stroke than in other people during the reproductive age groups. Also, the use of oral contraceptive pills and hormonal treatment in the recent age groups due to lifestyle changes like PCOD increase the risk of stroke. And other unconventional risk factors like lack of sleep, stress, frequent usage of smoking, alcohol consumption, drugs, illicit drug usages, and other hidden cryptogenic conditions. Even after extreme investigations, majority of the time 30% of strokes, the mechanism of strokes are not found out. So those are all very important to come to the center where the stroke experts are available.
So how is a stroke diagnosed in younger adults, Doctor? You mentioned about different underlying factors which are not even identified.
True.
How are they recognized? As a layman, how do I know that I'm suffering from a stroke?
True. So stroke, brain has a plethora of symptoms, unlike heart attack which has only chest pain. So in brain stroke we have a classical adage called be fast, which is balance, visual disturbances, you have facial deviation, you have arm or leg numbness or weakness, and speech disturbances, which is very classical for any stroke. But having said that, majority of the time in young strokes, they won't come with either speech disturbances or paralysis. They often come with a confused thinking. They often comes with dizzy feel or a giddiness, and sometimes even they comes with a headache and as an outpatient also. So majority of the time they won't give the importance of diagnosis as stroke, so they ignore their symptoms and they come very lately to the emergency or to the hospital presentation. So it is trivial sometimes it's dangerous unless you think of stroke and you can't diagnose them immediately. So stroke in young is always a stroke caveat, so we should be very careful.
So what should they do when they see such symptoms that you mentioned about?
Yeah, so any symptoms and signs which is sudden in onset is stroke unless proven otherwise. So that is the message we used to give to the public. Anything which is sudden, like any balance, any nausea, any headache, anything vomiting, but it's not all symptoms only alone, you should not be panicking. So if it is a constellation of other symptoms like numbness or one-sided symptoms or both-sided symptoms, then think of stroke. It is always better to come earlier. Do not assume anything. So come to the emergency where there is a 24/7 availability of imaging and a neurologist available, so that they can be easily diagnosed quickly and then start the appropriate preventive measures to prevent the final outcome of stroke.
You mentioned about diagnosing it early, where early intervention is the key. there is also an acronym of golden hour.
True.
Can you elaborate about it?
Yeah, so there is an adage called time is brain. So time lost is brain lost. So each and every seconds after a stroke, some almost millions of nerve cells are dying. So first thinking of stroke is important, then immediately go to the imaging is important, because only the MRI can able to pick up the diagnosis of stroke, unlike in heart attack where ECG can pick up and some enzymes can pick up. So only a CT scan can be normal in acute ischemic stroke for 48 hours. So normal CT scan does not rule out an ischemic stroke. So said that you have to come to the center where there is an availability of 24/7 360-degree round the clock imaging facilities like MRI, which can diagnose stroke, so that you can start the treatment like tissue plasminogen activator or thrombolytic therapy for even in young stroke. So it is approved after the ages of 18 years. So it's not only the old who get strokes and treatment, so the younger can also get these facilities. Also, more and more young strokes with large vessel occlusions are coming. So these are all the candidates where they need to go for a cath lab procedure called thrombectomy, where the blood clot is removed instantly so that the blood flow is restored, and they can reduce the volume of final stroke and henceforth the mortality and the morbidity.
So identifying a tertiary care unit is very important?
Crucial, very crucial. Timely reaching out to the nearest stroke center, mapping the stroke hospitals are very crucial.
Do genetics play a factor or a role in increasing the risk of stroke at a younger age? If so, what are the signs that I should look out for?
Sure.
Or what should I be aware of?
Yeah, so very important vital question. So anybody in the family who has a history of heart attack and stroke are more prone for strokes and heart attacks in the next generation. So said that genetics may play a role for almost all the disorders in human health, but stroke is a minority, like 1/10 or 1/10 of the problem. So identifying a family history is important. And then if you have a worry about stroke, you go to the neurologist. Not all the master health checkup will screen for your risk of stroke, because they are only limited to cholesterol, diabetes, BP and your heart. They won't screen for your blood flow. So you need to do an angiogram or at least a carotid Doppler to look for any occlusions of your blood flow. If that is there, then there is a risk of ischemic stroke. Very rarely you may have hemorrhagic stroke also due to the rupture of blood vessels like aneurysm or AV malformation. So in that scenario, you may need a definitive angiogram to confirm the diagnosis of aneurysm. So it is better, the genetics, family history of stroke is important. There are other conventional genetic risk factors which I think stroke experts will tell you how to deal with those conditions.
Doctor, we've got a lot of questions from our viewers, especially mothers of these younger adults, where they feel that access to digital devices are so huge today. Is that a factor that can contribute to stroke for their children?
True. So in the last almost 1 or 2 decades, digital media plays a vital role in almost all the health hazards. Said that yes, it affects the brain. So once it affects the brain, it affects the chances of stroke also. More than developmental disorders, memory, attention deficit and lack of concentration, those are all the most common problems. But in adult, if you have lived more than 1.5 decades of digital media, you are more prone for health hazards, because your attention span reduces, your personality will become a stressy personality, you will not be easily adjustable to other negative aspects of your life. So it increases indirectly your score of stroke risk by increasing your blood pressure, by increasing your lack of sleep, by increasing your obesity, by increasing your tendency for addiction. It's not only the smoking is addiction, even gaming, even digital media is also an addiction. So this also plays an important small risk for stroke. And also once you had a stroke also, once you are again, you will be hooked on to the devices, again you will not do justice to your stroke recovery, because you will not have physical activity, you will not have a good quality of life.
Are strokes more common in men or women, doctor, in the younger age group?
Strokes are common in all genders across all ages, but in young strokes, I think personally women have more edge over male gender, because during those 45 years of age group, they have to go through the normal physiological process called puberty, pregnancy and menopause. which is unlike, though there is andropause in male. So this is unlike male. They go through a lot of hormonal fluctuations that itself increases the risk of stroke. Said that, I think sometimes nowadays young girls, they are forced to take hormonal devices, drugs, oral contraceptive pills for so many reasons, and this increases the high dose of estrogen, increases the risk of ischemic stroke, and also female have more chance of headaches. Migraine with aura are a specific risk factor for stroke. So those who have difficult to treat migraines with visual aura, these are all the small percentage of people that can develop strokes without any hypertension and diabetes also. And more often in the elderly, females are having more strokes because they lost the protective role of estrogen after the ages of 55. So the incidence is 1 in 3 female get strokes and 1 in 5 male get strokes. Once you had a stroke, the females have more deaths than male. So these are all the numbers to remember. So better screen for your risk factors before you get complicated strokes.
Which was my next question. What do you do to reduce the risk of the onset of strokes?
So it's very vital questions, because none of us think unless we have an emergency. So that's a point, awareness to be created. So the unconventional risk factors are the one which is rampant now, which we cannot be dealt upon. Everybody knows about diabetes, everybody knows about hypertension, everybody knows about cholesterol, obesity and all. So the most commonest unconventional risk factors is lack of sleep and poor lifestyle. They go to gym, they won't sleep. They want to increase their financial capability, so they overwork and take a lot of stress, and for social recognition they go for parties, they drink, they smoke sometimes. So
takes a toll on their mental health.
They toll on a complete mental, because you won't be happy, you won't spend time with your family, you will not laugh, you will have a lot of other prerequisites to deal with even before you finish your day, and then it affects your mental health, your cardiovascular health, your general health. So that's why we are getting more young diabetes, and India is the capital of diabetes. So Asians are the one who are getting all these cardiovascular health hazards than Western population. So you need to start early, starting from your adolescence to adult age group. The importance of a proper sleep, that indicates it's not a good sleep, it's a regular sleep hygiene. Then avoid so many other risk factors like unnecessary smoking is very bad. Alcohol, limit the consumption of alcohol. Eat properly, so avoid all the junk foods, avoid all the stored processed foods, cut down your sugar, cut down your salt. So, and then go for a physical activity, whatever you are enjoying it, like walk or a jog or a cycling or a yoga or a meditation. If you do everything in moderation, that is the key, because once you age, every year you will catch up with all these lifestyle hazards, and you can able to identify them, how you are better than others if your lifestyle is good. Even if you had a stroke, the chances of good recovery and good outcome is better in those who had a very good lifestyle.
Doctor, in an era of remote work culture, virtual meetings, and burnout culture for that matter, do you anticipate any unique challenges or health implications that could contribute to strokes in younger adults?
It's indispensable part of life now, almost including the doctors, every professional, the media professionals, everybody has these problems. It's a $1 million question. We are forced to do that, we can't escape from that, but the point to concern here is do everything in moderation. You have work, you have family, you have sleep, you have your own physical health, so give importance to that. Watch out for your alarming signals. If you couldn't able to sleep for 2 weeks, if you couldn't able to do your productive work for some times, so I think that is the brain is giving you a warning signal. So the warning signals are headaches, the warning signals are improper sleep, the warning signals are after a sleep you are not having the physical fatigue next day, so that means unrefreshed sleep. And then there are people who snores in the sleep, they think that they are having a good sleep. So sleep snoring is the most important risk factor for stroke. And then gaining weight, losing weight, and in young strokes there are other risk factors like inflammation. So people can develop strokes after COVID, people can develop stroke after even COVID vaccination. There are other anti-inflammatory markers, like any viral infections can develop a stroke. And sometimes we are developing countries where you can catch up with infections like tuberculosis. So we need to catch up with every other things. Not only that, accidents, trauma, all those things play a role in stroke in young. So these are all the most important thing, you have to protect your brain by good lifestyle and protect from all these opportunistic infections as well as trauma.
We'll take some questions from our viewers, doctor. I've been experiencing frequent headaches and dizziness quite often. Could this be a sign of an impending stroke given my age? I'm 23 years old.
Okay. So I want to know about whether it is a male or a female. So
It is a female.
Female. If I consider the female, I think the most possible diagnosis with these symptoms alone will be a headache with dizziness, which is often migraine with aura, which is the commonest primary headache. So those are all the people who, as I told you before, who has recurrent headaches for ages like 5 years, 10 years, and they consider them as ordinary headache. When they blame themselves like they didn't eat well, they went out in the sun, and so they don't diagnose them as migraine, and they don't prevent these headaches. They use only over-the-counter analgesics or balms. So when they come with a severe complicated migraine, so complicated migraines are the one where they have lack of vision sometimes suddenly, and that can be a warning signal of a stroke, and sometimes they can have memory disturbances due to headache, and rarely they can have vomiting and giddiness. Sometimes we call it as a basilar migraine. So these people are the one who have more risk of stroke when they have headaches, but not all headaches will have stroke, so do not worry. But headaches with visual aura, we will have one conditions like whenever there is a headache, there is a blurring of vision or some colored zigzag lights in front of them. So these are all the people who are 3 times more common than stroke than general population. And these female, if they have a tendency of using oral contraceptive pills, and if they are obese, and very rarely if they smoke too, then the risk of stroke is manifold.
My partner is a fitness enthusiast, but she also smokes occasionally. Could this combination increase her risk for stroke?
Definitely yes. Any risk factor, even a single risk factor, even a hidden risk factor is a risk of stroke. So it doesn't mean that your fit is external appearances. Fitness indicates a holistic fitness, internal, your cells, your mitochondria, every organ should be fit, So having physically fit doesn't mean that our body is completely safe from any health hazards, including stroke. Smoking is one of the important risk of stroke, and it increases the risk of stroke more than 3 or 4 times. And if you have any other risk factors like alcohol, lack of sleep, even if you are in a tier city where the air pollution is high like Delhi, then the risk multiplies. So you should take care of everything in total, and then you have to avoid all the preventable risk factors so that you can have a stroke-free life.
Hi doctor, I experience intense headaches, particularly while working in front of the computer. How can I distinguish between the symptoms of a migraine, signs of a stroke, or could it be a potential indication of a brain tumor? How do I distinguish?
So commonest OPD patients who come across in this outpatient in OMR. So everybody has migraine because of excessive exposure to laptop and digital media, and they are hooked to the computers for more than 8 to 10 hours. So those are all the people who are more risk of migraine than general population. That is because of direct penetrate digital exposure to the brain. So they should not worry about stroke because they are young, and if they don't have recurrent headaches, and if they don't have visual aura, these are all the patients who are safe from stroke. But there will be some population where they get strokes also. Those important persons are those who have recurrent headaches, which to the tune of 10 to 12 attacks in a month. Whenever they have attacks, more than 50% of the attacks have visual symptoms like blurring of vision or irritation of the eyes, and they want to switch off all the computers lights, and they want to lie down for some time. So those are all called visual aura, and they have excessive intolerance to cold, light, and sound. So those are all the people who are more prone. So migraines also have that, but if it is a recurrent migraine with visual aura, and if they use a lot of hormonal treatment for their menstrual irregularities and weight gain, so these are all the more people who should screen themselves for the risk of stroke. And if there anybody else in the family have young stroke, please visit your nearest neurologist for your seek and help your advice.
Doctor, with our increasing incidences of more younger people falling a prey to stroke, what would be your message to them?
So the message is the younger strokes is a nightmare for even the stroke experts also, because as I told you before, 30% of stroke in young, the causes are hidden. So we need a complete different team of expertise, because the cause can start somewhere outside the brain also. It can start from the heart. So not only the ECG echo will able to pick up. So in those types of population, we need to do a detailed echocardiogram called, transesophageal. Just like in endoscope, we screen the back of the heart to look for any blood clot which has dislodged from the heart to the brain. The second is atrial fibrillation, which is more common, the cause of stroke, which is missed often in a routine pulse examination and in ECG. So these are all the people who needs a long-term 7 days, 21 days loop recording for risk of atrial fibrillation and stroke. And there are other hidden causes like patent foraminal ovale, where there is a small hole in the heart which is not even picked up in even in the age group of 40s and 50s. And the first ever time the mechanism of stroke can be due to the patent foraminal ovale. So these are all the conditions where only the team of experts can able to identify the risk and then able to deliver the technology to obviate the need for recurrent strokes. When come to the other things, dissection. Dissection is a very important thing. I think a lot of people are involving in physical activities, sports and fitness. So they tend to have a blunt injury to the neck. When they have a insignificant blunt injury to the neck, in the next 2-3 weeks they are more for stone, because the blunt injury can penetrate the carotid vessels and produces a small luminal dent, and which due to the jet force of the heart pumping into the brain, it produces clot there and it gets discharged to the brain. So these are all called dissection leading on to strokes. And these are all the people, if you don't screen for any symptoms, like they will come with a neck pain. If you ignore the neck pain, and a few days later they come with a moribund stroke. So these are all important history. Headache is one history, unexplained giddiness is one history, history of fever, weight loss, rash in the young age group, because these are all the infections can also develop strokes, whether it is a viral infection like varicella, or sometimes some infections like tuberculosis can present with strokes also, complicated strokes also. So it's multiple. I think if anything related to sudden neurological symptoms and signs in young age group, it is always better to screen thoroughly the mechanism of stroke. Sometimes the mechanisms can be multiple, so you have to identify one by one and correct each of them.
Thank you very much, doctor. That was a very extensive talk and advice for all our viewers who are watching it today, especially for the younger generation.
Thank
For
you.
appointments with Dr. Sathish, Senior Consultant Neurologist and Stroke Specialist at Apollo Speciality Hospitals, OMR, please contact 044 4040 1066. I repeat, 044 4040 1066. Thank you very much, doctor. Thank you, viewers.
Thank you.